Okay, let's unpack this. Welcome to our deep dive. We're exploring some really interesting source material you shared, bits from the driving guidelines, neurological conditions.
Mm,
This document, well, it outlines the DVLA's rules for driving if you have certain neurological conditions.
that's right.
Our mission here is simple. Quickly pull out the key rules, the time frames, straight from these guidelines so you feel informed about what the DVLA actually requires.
Absolutely. And it's vital stuff, not just for staying compliant yourself, but really for road safety, for
Yeah.
everyone.
Yeah. It seems complex, though.
It is, but the rules try to offer clarity while, balancing individual situations. Let's dig into what the material actually says. Where should we start? Epilepsy.
Yeah, the source spends a fair bit of time on epilepsy and seizures. What are the sort of main takeaways there?
Okay, so the guidelines make distinctions based on seizure history.
Hmm.
For a first unprovoked seizure or an isolated one, there are kind of two paths.
Two paths.
Yeah. If tests like brain scans show no major structural problems, so no obvious physical cause,
Right.
and an EEG doesn't show clear epileptiform activity, those abnormal brainwaves linked to seizures,
Mm-hmm.
then the time off driving is typically 6 months.
Okay, so if the tests suggest a lower risk, it's a shorter ban.
Exactly. Seems that way.
Yeah.
But if those conditions aren't met, maybe the scan does show something or the EEG is definitely abnormal,
Mm-hmm.
then usually goes up to 12 months off driving. So those initial test results, they seem to carry a lot of weight.
Right, makes sense. They're looking for signs of future risk, yeah.
Precisely.
What if someone has established epilepsy or, has had multiple seizures without a clear trigger?
Right. Different scenario.
Mm.
In that case, the requirement is you need to be seizure-free for a full 12 months.
12 months, okay.
That's to be eligible for a license again.
Yeah.
But there's an interesting point in the material.
Oh, yeah.
If you manage to stay seizure-free for 5 years straight, even if you're still on medication,
5 years, wow.
yes. The guidelines suggest you can often qualify for a till 70 license. It acknowledges that long period of stability, you see.
5 years seizure-free, even on meds, for that longer license. That's a really key point.
It is.
And what about stopping medication if someone comes off their anti-epilepsy drugs?
The guidelines are very clear on this. No driving while you're withdrawing from the medication.
Right.
And crucially, not for 6 months after the very last dose.
6 months post-medication. Got it. Okay. Moving away from seizures. Syncope, fainting. What do the rules say there?
Syncope, yeah. The rules really depend on why the faint happened. If it's a simple faint, like standing up too quickly, vasovagal.
The common faint.
Exactly. Generally, no driving restriction mentioned for that. But if it was a single episode and they figured out why and treated it,
Okay.
then it's typically 4 weeks off driving.
4 weeks if it's explained and treated. That's quite short.
Relatively, yes.
Yeah.
But contrast that with a single episode that remains unexplained after tests. Then it's 6 months off driving. That uncertainty clearly bumps up the restriction period.
Right. And if fainting happens more than once, multiple episodes.
If you've had 2 or more episodes, it jumps again, 12 months off driving. Recurrence is obviously a big factor in the risk assessment.
Those differences really show how important getting a specific diagnosis is, doesn't it?
Absolutely.
What about some of the other conditions? The source mentions a few others briefly.
It does, yeah. Stroke or TIA, a transient ischemic attack or mini stroke. The general rule is 1 month off driving.
1 month.
But interestingly, the document notes you might not even have to tell the DVLA if after that month there's no lasting neurological issue affecting your driving.
So if you fully recover quickly, it's simpler.
Seems so. But if you have several TIAs in a short space of time, that changes things. It becomes 3 months off driving and you must inform the DVLA. Suggests a higher perceived risk there.
Okay, so the pattern of TIAs matters. What about brain surgery? Like a craniotomy for a meningioma?
The general rule after a craniotomy, according to these guidelines, is usually 1 year off driving.
For a full year.
Typically. But there's a specific exception mentioned. If the surgery was for a benign meningioma and you didn't have seizures before the surgery,
Yes.
your license can be reconsidered earlier, at 6 months after the operation, if you've stayed seizure-free in that time.
Okay. So the type of tumor and seizure history makes a difference?
It seems to, yeah,
Yeah.
reflects a potentially lower risk profile.
And pituitary tumors needing a craniotomy, is that different?
For a standard craniotomy for a pituitary tumor, it's 6 months off driving mentioned.
6 months.
If they removed it using the transsphenoidal route, through the nose, less invasive.
Right.
Then the guidelines say you can drive again once there's no remaining impairment affecting safe driving. So the type of surgery matters for recovery time, too.
A clear difference based on the surgical approach. Interesting. What about conditions like narcolepsy or cataplexy, sudden sleep issues?
For narcolepsy or cataplexy, the rule is stop driving immediately on diagnosis. Full stop.
Right away.
And you can only start again when symptoms are properly under control. That likely needs specialist confirmation. It's all about preventing those unpredictable episodes while driving.
Makes sense. And lastly, chronic conditions like MS or motor neuron disease, things that progress.
For those chronic, potentially progressive disorders, the key step highlighted in the source is you must tell the DVLA when you're diagnosed.
Inform them straight away.
Yes, and complete the PK1 form.
Yeah.
That lets the DVLA make ongoing assessments based on how the condition is currently affecting your driving ability.
Wow. Okay, so that's quite a range of rules and timeframes. It really depends heavily on the specific condition, the circumstances.
Exactly. It's definitely not one size fits all.
What really stands out to you from looking at these specific rules in the source?
Well, I think it's how the rules try to specifically quantify risk. They use timeframes, test results, treatment success, seizure history, to try and balance the risk associated with the condition against, the person's individual situation and stability. It's quite a detailed, granular approach.
Yeah, you can really see the detailed thinking based on these excerpts. It's not simple.
No, it isn't. And it brings up a broader point, maybe something for you, the listener, to think about. These rules, they're about protecting everyone on the road, but also trying to let people drive when it's safe, seeing how varied the rules are for different conditions. What does that suggest about the challenge of regulating something like driving when people have health conditions that can change or be unpredictable? How do you think that balance is struck in practice between the medical evidence, individual lives, and public safety? It's complex.
It really is. A lot to consider there. Well, thank you for sharing these sources with us, everyone. It's been fascinating taking this deep dive into the DVLA's neurological driving guidelines.